and welcome to CrossTalk. I'm Peter Lavelle. The AIDS biz fighting a deadly virus, or the endless funding of Big Pharma? How much consensus is there within the scientific community? How much dissent? Does confronting the AIDS epidemic need a complete rethink? To discuss the world's largest medical problem, I'm joined by Dennis Brun in Vienna. He's the United Nations AIDS Regional Director for Europe and Central Asia. In Meinheim, we have Peter Duesberg, a professor of molecular and cell biology at the University of California, Berkeley. And in New Haven, we go to Steve Ketterer. He's the president of Global Pharma Insights. And another member of our CrossTalk team, Yelena Hunger. All right, gentlemen, CrossTalk rules in effect. That means you can jump in anytime you want. Denise, I'd like to go to you first in Vienna. You're at this International AIDS Conference. It's the 18th. Fundraising is an issue. I seriously doubt awareness has to be an issue, at least in the modernized, industrialized world. Everyone knows about this epidemic. So what do you hope to achieve at this conference? It looks like, at this point, it's the conference of low expectations because of the recession.
Well, I wouldn't say that completely. First, there is a level of awareness which is very low in some parts of the region, in Eastern Europe and Central Asia. We find that among young people, sometimes more than half do not know how HIV is transmitted, do not know how to prevent it, how to protect themselves. We also have other types of expectations at this conference is to share some of the new things on science. You know, today it was announced that the clinical trials of a new gel, including tenofovir, was protective for women to a pretty large extent. So there are new things coming up. We know also that keeping more than 5 million people on treatment is going to be a challenge because new money is not coming up.
Okay, if we can go to Mannheim, to Professor Duesberg, what do you think about this process going on in Vienna? It's the 18th conference on AIDS. Also, the issue of raising billions and billions of dollars to fight this epidemic. What do you think about what's going on in Vienna right now?
I do think it's a problem, but the problem is actually much less so than it's commonly advertised. The reason is that AIDS, the AIDS virus, when it was first discovered in 1984, it was thought to be a new pathogenic virus that would cause a general epidemic decimating people in the United States first, where it was first presumably discovered, and then in the rest of the world. It would be a fatal epidemic like the flu, the Spanish flu in 1918, where millions died, or the polio epidemics in the 50s and 60s, where thousands and thousands died in the Western world. And a vaccine was promised right away to be available 2 years later. But what happened now in the last 26 years is much, much better than predicted. And it was, in fact, there is no epidemic. And people don't want to admit to this after they predicted so many times it would happen. There is none. There is no epidemic in the Western world. Hardly anybody ever got AIDS. Only 2 or 3 risk groups, male homosexuals and intravenous drug users. There was no epidemic in Europe, none in Asia, none in South America. They mentioned still there may be something coming in Africa, but even that seems to be flawed. So we have actually some good news here. We have no general epidemic. There is no mass deaths in the Western world for sure. And unfortunately, well, we don't have a vaccine, but we don't need a vaccine if we don't have a virus that would cause a pathogenic or a flawed or an epidemic.
Okay, if I can go to New Haven here. Steve, the professor paints this as not being such a big catastrophe as we hear all the time in media. A lot of people actually call this the AIDS industry. There's enormous amounts of money put into advocacy, awareness, and I would agree with you in Russia, Central Asia, Eastern Europe, awareness needs to be heightened, but still at the same time in the industrialized West, as the professor pointed out, a lot of people do know about it. I mean, for Big Pharma, as it's called, I mean, this is an important industry for them fighting this virus, isn't it?
Well, you know, AIDS is part of the portfolio of any drug company that's manufacturing drugs. It's usually a very small part. There are companies like Gilead, which is definitely the leader these days, where AIDS drugs are the majority of what they do. But if you look at any other AIDS drug manufacturer, HIV is actually a very small piece of their business. So I think that the AIDS drug companies look at this as definitely an opportunity for profit. This is a capitalist society. They have to make money. They have to cover their R&D expenses. They have to be able to produce new HIV drugs, and they do that by making money on the drugs that they have already produced. But they also look at it as a social issue. And I think that with the exception of one or two companies, which I personally choose not to work with anymore, the AIDS drug companies have done a very nice job of trying to understand this market, get out there, identify challenges where they can make a difference, and direct funding so that they can be helpful. I think that these are huge problems. They are not problems that any one drug company's budget can cover. But in the clients that I work with, and my job, just so everyone knows, is basically to represent the voice of people with HIV, as well as healthcare providers, whether those are doctors, PAs, nurses, to the drug company, so that the drug company knows firsthand what the needs are, what the opinions are, how they can introduce better versions of the drugs they've already got, create new drugs that are easier to take,
but
have
Dennis,
fewer side effects.
I agree with you, but the Big Pharma has really had a bad rap over the last few years. Maybe the last 2 or 3 years it's gotten its act together, at least as a public relations point of view, because a lot of people are saying just making huge amounts of money off of it. I'd like to go back to Big Pharma a little bit later, but I'd like to go to Denise here. At the United Nations and other advocates that you have come across in Vienna, are they satisfied with the participation and the work that Big Pharma has done in dealing with this virus? Because, like I said, over the last, except for maybe the last 2 years, the Big Pharma had a very black name when it came to dealing with this virus.
Well, it's difficult to say that. I mean, you have all the inventions for HIV have been developed by Big Pharma. They have come up from a whole set of different laboratories, public, private, but Big Pharma has been developing them, getting them to patients, and these drugs, when they fell out of patent, have been taken by generic manufacturers who are very important suppliers for the treatment of people around the world. So there is kind of a partnership. It may not be always an open and brotherly partnership, but it's there between the community fighting HIV and the pharmaceutical industry.
Okay.
And thank God that they are doing these drugs.
Okay, if I go to the professor in Mannheim. Professor, do you think that... what is your opinion of Big Pharma in dealing with this, fighting this virus? I mean, a lot of critics and a lot of people that would be critical of you also say that this is just a huge money bag. I mean, the pharmaceutical business is a $350 billion business a year. It's growing 10%. I mean, in an environment like this, it's doing pretty well. I mean, what do you think of their role in fighting AIDS?
I mean, from the point of view of AIDS research or AIDS science, this is a big disaster, because the drugs are all aimed at inhibiting a virus, the so-called AIDS virus, which doesn't do anything. It is not pathogenic. There are 40 million people on this planet, according to the WHO, who have HIV. Most of them don't even know about it. They're completely healthy. A third of the African population is estimated to be positive. The African population has doubled, I'm saying, from 400 to 800 millions in the last 25 years since they are infected by this virus. Or 25%, whatever you want. But the WHO has overly advertised they are all infected and they're all going to die. The reality is they have doubled. And they carry the virus that doesn't do any harm. And the companies try to treat the virus that doesn't do anything with drugs that are inevitably toxic. Okay. The drugs were developed, the ACT was developed 40 years ago for one purpose, to kill human cells for cancer chemotherapy. And the result is they have never ever cured one AIDS patient. They even say that.
Okay, Dennis in Vienna, you disagreed with that.
Yes, of course. I mean, we have 2 million people die of HIV infection every year, and these are not people who die of old age, I can tell you that. The average age of people who die in Russia is 32 years. This is preposterous. I mean, the antiretrovirals are keeping people alive, and people are staying alive thanks to administration of these products. And we have now 5 million people on antiretrovirals, and it's thanks to that mortality has decreased so much that people live a normal life.
All right, Professor, would you like to reply to that? He strongly disagrees with you on that. He strongly disagrees with you on that.
He disagrees without providing any evidence. The only people, I said 40 million are not treated and they're doing well. It's the people who are getting these drugs that are inevitably toxic. They are designed to terminate DNA synthesis. That's the central molecule of life. You're dying from that. That is AIDS by prescription. And 500,000 people are prescribed these drugs alone in the US. And all of them now die, about half of them die from diseases that have nothing to do with HIV, that have never been attributed to it.
Before we go to the break, I'd like to go to Steve. Excuse me, Professor, excuse me. I'd like to go to Steve in New Haven here. The professor is essentially saying that the companies that you represent are killing their patients.
That's what I'm saying. The drugs are AIDS by prescription.
No, Professor, let's listen to what Steve has to say here. Go ahead.
I would say that Professor Duesberg's opinions on the good side are disrespectful, and on the worst side are tantamount to murder. I just want to say that when 3-drug therapy was introduced in 1996, we were able to see a decrease in AIDS-related deaths after 4 years of 84%. So that's doing exactly the opposite of what he's saying. The drugs were not killing people. They actually have made an enormous impact on saving people's lives. Since 1996...
Steve, I'm going to have to jump in. I'm going to have to jump in here, gentlemen. After a short break, we'll continue our discussion on AIDS. Stay with RT.
Problem, Peter.
Okay, I'd like to go back to Steve in New Haven. You were making a point about, in reacting to what the professor had to say, is he's saying that some of the drugs that are being developed are actually hurting their patients, even killing them, and you're defending the industry. And in researching this program, there is a debate, though there's a very small minority, and the professor is one of them, that these drugs are very counterproductive, and actually it's creating more and more drugs to just keep the process going. It's good business. I mean, that's one of the criticisms.
You know, this brings me back to the mid-'80s when I was a consultant to Burroughs Wellcome, which was the company that introduced the first AIDS drug, AZT. And we would go out to interview people and talk to them about sometimes their hesitancies in taking the drug. And we now know that AZT is an incredibly toxic drug, and most people try not to prescribe it when they don't need to. But we heard back then, especially from African Americans, that they thought that the drug had been created by the U.S. government in order, as a type of genocide. And, you can understand where opinions like that came from when people are coming home, taking this drug, having all kinds of horrible reactions, and people around them are seeing this and saying, well, I don't want any part of that. But, we're 25 years from that. We're not in the mid-'80s anymore. And, so while there may have been some suppositions that could have existed to support Dr. Duesberg's theories back then, let's deal with what we know now. The drug companies have made these drugs a lot less toxic. They have gotten the formulations down to the point where now we're about to see 4 drugs introduced in a single pill once a day. That's never been existent before. We have very exciting new findings, such as Dr. Brune just mentioned with the tenofovir gel, which is cutting incidence of contracting HIV in half by people who use it correctly.
Denise, would you say maybe, and we can say more broadly, is there a wide debate within the discussion about how to deal with AIDS? Because there will be people like the professor that we have in the program, and people that support him, saying that there is no debate allowed in this endeavor. How would you describe that? Is there a debate on how things should be done, or is it just so closed and narrow now that other voices can't be heard?
No, I mean, any voice can be heard. I think people are free to express any type of opinion. We must be careful that people do not express opinions which are dangerous to patients. So we have seen in Russia some religious fundamentalists denying that there would be any HIV, and it was God's punishment that had to be accepted by the patients. We don't think it's a way of having a constructive relationship with people living with HIV and helping them in their fight against the disease. I consider, unfortunately, Professor Duisberg's opinion of being of the same vein. What is clear in this conference here in Vienna, we have more than 20,000 people, and I can tell you there's a very lively debates happening all the time with demonstrations and a lot of opinions expressed, but no one is saying anything like denying the role of HIV in creating AIDS or saying that the drugs are dangerous for people. Actually, there's really a kind of a universal movement to make sure that people access treatment. It's what saves them.
Professor, if we can go back to Mannheim, how do you react to that? Is there a lively debate, a lively discussion on how to deal with this virus? Because in preparing for this program, you're not the most liked person when it comes to this field of endeavor.
There is indeed one right now discussion, as you can hear from Steve and Dennis. They're calling everything I'm saying Duisberg's opinions. But I'm relying on the toxicity of the antiviral drugs, on studies that have been published, so-called controlled studies in the New England Journal of Medicine, in the Lancet more recently, the Concord study, that has used AZT, the same drug that he now admits is a little less toxic than it used to be. That was not by Africans, that was reported by an Anglo-French study in the Lancet, the oldest medical journal, that it would increase mortality 25% compared to untreated people, and that it was not recommended as a drug to prevent AIDS, and that is how it is prescribed now. That is not my opinion. I am not a mass murderer for citing evidence that is published in the Lancet and in the New England Journal of Medicine. And he also added, that was, I think, Dennis, or was it Steve? I can't say now which of the two, that the discussion is so free and we have an opinion to voice. Why don't they recognize or acknowledge that there was an alternative AIDS conference in Vienna just 2 or 3 days ago, and that I was one of the authors of a paper that questioned the drug treatment specifically, that was published in Medical Hypothesis in England last year for 2 months, and then it was censored. It was taken off by anonymous, based on anonymous charges leveled at our paper from AIDS researchers, HIV/AIDS researchers, presented to the publisher Elsevier. They fired the editor, they changed the journal, they censored 2 papers. That's a Nazi move, if you've ever seen one. Okay. That is not free exchange and free debate.
Okay, Denise, did you want to jump in there? Because I'd like to go to Steve. Go ahead, Dennis.
Yes, I'd like to pitch in on a very short thing. AZT is indeed a dangerous drug. We know it. This is something which was used 25 years ago. Then it was decided long ago to go into tree therapy. No one in his right sense is suggesting to use AZT alone today. It's as if people were suggesting to treat syphilis with arsenic, as was done in the beginning of the century. This is finished. We now have cocktails. We have groups of drugs which have much lower toxicity. We cannot discuss today's situation on the basis of antique type of data which are no longer valid in any way.
Okay, Steve, if I can go to you, I mean, maybe just more of your opinion on the people that you deal with in the industry. What the professor had to say about his paper being censored, taken down, and all of that, and then the problems he had at Berkeley having to be reviewed and all that. I mean, that sounds pretty severe. I mean, if you don't really like what the professor has to say, why don't you just ignore him? But he seems to be constantly attacked. And I'm not defending his position, but maybe just his right to be able to say what he wants. That's why he's on the program.
I think that anyone should be able to say what they want. This is the United States, and that's one of the greatest parts about this country. And the problem is, as I think that Dr. Brun just referred to, is when you have an extreme opinion that gets attention, and it's based on completely obsolete data, it can actually cause harm. You know, Dr. Duisberg was on President Mbeki's advisory council and was one of the real voices that led him to, you know, really decide that HIV didn't cause AIDS and to pull the plug on a lot of programs that could have saved hundreds of thousands of people's lives. That's dangerous. So I think that while people should be able to say these things and be presented, you know, as part of data to be considered, when someone in power who's already a little unbalanced gets a piece of information like that, it can really have disastrous consequences. So I'm worried about that, and I just think that this really ought to go away. We should be focusing on the future and, you know, how to improve things from here, how to get these drugs into more people's hands, especially in the developing world, and stop really chasing our tail about something that has no relevance anymore.
Okay, Professor, I mean, there was some allegations laid against you. Are you a dangerous man?
If Dennis and Steve think that science is dangerous, speaking based on evidence, and I have evidence for every one of these numbers, that's why it was censored, the paper. If they had been able to answer it, giving concrete answers, why ACT, which is still in all antiviral drugs, it's one element of the cocktail of 3 or 4, why ACT, which is designed to kill human cells, it is a DNA chain terminator, is all of a sudden fine, that would be another matter. There are no new publications saying that. There are American publications in the New England Journal of Medicine which say that this treatment, half of all AIDS patients in America nowadays die from diseases that have never been attributed to HIV. They are all attributed to antiviral drugs. I'm talking about liver diseases, heart diseases, and kidney diseases that they're dying from. It's published in the New England Journal of Medicine and in JAMA. Reisler is one of the references. You can look it up yourself. In 2003, in 2006, in 2007, very recently, not 20 or 30 years ago, as you imply. And also about the epidemic in South Africa that I'm responsible for, where you used the kind word of mass murderer. That was the part of the paper, again, that was censored. We checked the statistics. The statistics show that in the same year where the Harvard study from Essex claimed that we had murdered 1.8 million, the population grew by 3 million, 500,000 every single year. Those are the published facts. You can verify them. The censorship is because we were not supposed to say that, because it would undermine the idea, the propaganda that HIV is a deadly virus.
Well, we can see there's still many opinions on this subject.